Namaste, sir. Vage, sir.
Namaste, Suprabhatam, madam.
Yeah.
So nice to hear your voice.
Thank you.
Sneha, are you there?
Should I start, sir? Yes, I'm there. Yes. Shubha Madhyanaha. A very warm welcome to one and all who gather here to attend today's webinar. On the occasion of World Diabetes Day, Jupiter Ayurved Medical College, Shankarpur, Nagpur organized today's webinar in association with Rognidan and Vikruti Vignan PG Association, a national webinar, Prameh Prabodhanam 2022. I, Dr. Sneha Naringe, Assistant Professor in Kai Chikitsa Department, feel privileged to host today's webinar. We are happy to inform you that our today's webinar is approved by MUHS. Our today's speaker is our respected Principal Sir, Dr. Subhash Waghe sir. We also have respected Dr. Sandeep Mane, MD Ayurved and PhD scholar as a MUHS observer. Sir had completed his BAMS from Shivaji University and MD in Kai Chikitsa from R.A. Poddar Medical College, Mumbai. Sir is a PhD scholar at Shegav Ayurved College. Sir is a highly proficient and qualified Ayurvedic consultant having 13 years experience in both Ayurvedic practice and educational institute. Sir worked in various areas like Ayurvedic clinic, administrative, technical operations. Currently, Sir is working as a professor in the Department of Kai Chikitsa at Siddhakala Ayurved College, Sangamner. I also welcome respected Dr. Rupa Bhatt ma'am, who is with us as a moderator. Madam is the principal at Dhanvantari Ayurved College at Siddhapur, Karnataka. Thank you, ma'am, for joining with us. Our chief patron for today's webinar are respected Mrs. Tarini Nikhare ma'am, Secretary, Gurudas Shikshan Sanstha, Dr. Aishwarya Ranade ma'am, and Dr. Santosh Chauhan sir, Secretary of RVPGA. Again, I welcome all the respected dignitaries and all the participants for joining today's webinar. Before starting our webinar, I request Dr. Aishwarya Ranade ma'am to please introduce RVPGA. Over to you, ma'am.
Am I audible?
Yes, you are clearly audible, ma'am.
Yes. A warm good afternoon in this shivery winter afternoon to all of you. First of all, I would like to extend my gratitude towards Jupiter Ayurved College, the principal Dr. Waghe sir, and to the office bearers of RVPGA for allowing me to introduce the organization in this national webinar approved by MUHS. To start with, initially this organization was started with a motto to fight, to stand strongly, to maintain the status of the subject Roga Nidan in the academics, to give and to maintain a status quo to the subject, and basically and foremost to prioritize in providing or in establishing the legal requirements for the students or who are for the postgraduate students of Rog Nidan subject. Now, the horizons of the organization have been extended not only to legal fights, but to provide updated knowledge about the subject, not to the teachers, but to students also. Now we are organizing many webinars, especially for students, to acknowledge them with various simple to hard to explain subjects, so that they can be a good academician, and of course ultimately they could be a good practitioner in the field of Ayurveda. Roganidan is a subject which is the heart of any medical science, especially in Ayurveda. The treatment depends on how perfectly you diagnose a disease. The pattern we have in Ayurveda, the medico-legal pattern or the curriculum according to NCISM that we have since 1971 is that we have through council we are being allowed for the modern practice. In curriculum we learn modern subjects, modern topics, but up to a higher extent we are not medico-legally that much strong to fight or keep ourselves stand strongly in the society while practicing modern medicine. So the foremost and most important fight, or the most important aspect of this organization, is to achieve the medico-legal essentialities to the subject and to the practitioners or to the postgraduate students who are being passed out as a postgraduate student in Roganidan subject. And in academics, the webinars are being organized, but now the national conferences are also in channel to we are planning to organize national conferences to update our students with modern medicine or the modern modalities and the needed Ayurveda topics also. Recently, since last few years, we have organized national awards, Nidana Shri Award, Nidana Bhushan Award, and Best National Nidan Teacher Awards to encourage our teachers to give more and more with all their best to the students to make them understand the subject easily and make it more interesting. So this is all about the organization. I thank you, organization, and the organizers of this webinar, and Dr. Waghe sir for allowing me to be here in this webinar. Thank you so much.
Thank you, ma'am. Thank you for the brief introduction of the RVPGA. Thank you. You told us how RVPGA works for PG students in Nidan subject, how it fought for the students for the medico-legal issues, and how it spreads the knowledge for the students and everyone who need it. Thank you, ma'am. Now, we are going to start our today's session, but before that, I would like to introduce our today's speaker, Dr. Subhash Waghe sir, Principal, Jupiter Ayurved Medical College, Shankarpur, Nagpur. Sir had done BAMS from GSC Nagpur and MD in Rog Nidan from Sri Ayurved College, Nagpur. Sir is a PhD scholar at MHS. Apart from these degrees, he has many degrees and diplomas to his credit from medical sciences to Indic sciences. Sir had written 18 Ayurvedic books, from which for 2 books he had got Best Book of the Year award from Ranade Foundation, Pune. He wrote 42 research articles in national and international peer-reviewed ISSN journals. He reviewed 8 lost Sanhitas of Ayurveda and was felicitated at Latur by Ayurveda Update Group for the same. He is on the editorial board of ISSN journals like JONAM, IJIM, CMIR, Revista, etc. He presented many research papers in various national and international conferences. He twice got the Best Paper Award. He was a member of Team for Framing Nidan Dictionary by Government of India. He was invited as resource person to more than 40 national and international seminars and conferences. He also took lectures for international delegates of Brazil, Portugal, and Russia. He had received 14 different awards like Vaidya Yadavji Trikamji Grantha Puraskar from Vaidya Khadiwale Pratishthan, Pune, Nidan Shri Puraskar from Ayurved Mahasammelan, Vidarbha Pranta, Dhanvantari Puraskar from Dhanvantari Jayanti Samaroha Samiti, Ideal Teacher Award from Lions Club at Nagpur, and Best Academician of the Year 2022 award from Doctors Association, Nagpur, and many more. So I request to such a dynamic personality, Dr. Subhash Wage sir, to deliver his lecture on the topic Prameh Prabodhanam 2022. Over to you, sir.
Thank you, Sneha, for introducing me such a precisely. We will start the lecture. Slides are visible?
Yes, sir.
Okay, fine. So let us move on and see the global burden of diabetes on occasion of World Diabetes Day. Nowadays, there is havoc of diabetes in India, particularly since we are having the type A personality, and our belly is going to get enlarged because of the visceral fat that we have inherited since many centuries, and most of us are likely to get affected with diabetes sooner or later. Now, let us see the global burden, and thereafter it's the entire all about the diabetes. So in the world, 1 in 10, that is almost 10.5% individuals are living with diabetes. The predicted rise by 2030 is 643 million, 11.3%, and by 2045, it is going to be 783 millions. That is 12.2% of the population. In the world, 240 million adults living with diabetes are undiagnosed. This is very significant. These 44.7% people are still undiagnosed. 60% of people with type 2 diabetes lives in Asia, that is China and India. And particularly India is going to become the global hub of the diabetes. In India, approx 1.3 billion diabetics at present, which is 4 times the population of United States. By 2045, estimated diabetic population in India is going to be 24 million, and Tamil Nadu and Kerala being the worst hit, as they use there's plenty of rice they eat in their as their eating habit, and they cook it in a coconut, which is coconut oil, which is having the highest one of the highest saturated fat index. We will see that more than 95% of the people with diabetes have type 2 diabetes, which is the predominant. Majority of people with diabetes are in the age range of 45 to 65 years, more common in Asia and in males. And in developing countries, it is more common in males as compared to in developed countries, it is common in females. It is a major cause of blindness, kidney failure, heart attack, stroke, and foot amputation, as we know. In 2019, 2 million deaths occurred due to diabetic kidney complications, and over 1 million deaths occur per year due to the diabetes. So it becomes very essential to look for the remedy in our science. And nowadays, Ayurveda is the only science which says that diabetes can be cured. And there are many agencies now which are carrying the diabetes reversal program. Here in Nagpur also and across Maharashtra also, we heard much about the Madhobag. And there are many other places also which are carrying out the diabetes reversal program. So let us see some history of diabetes. Diabetes mellitus is derived from the Greek word diabetes, meaning siphon, that is to pass through, and the Latin word mellitus, meaning honey or sweet. Diabetes was recorded in English in the form of diabetes in a medical text written around 1425. See, modern it is 1425, and it was in 1675, almost the 17th century, that Thomas Willis added the word mellitus to the word diabetes to indicate sweet urine. Now, whereas in our literature, which goes back to almost 5,000 years back now, and there is clear-cut indication of madhumeh. The word is madhumeh, honey-like urine, and it is most all the types of which we are going to see in subsequent slides. All the types of diabetes what we found today, they are also been described in Ayurveda in a very scientific manner. So, definition of diabetes as per Ayurveda, which is also called as Prameha, it is very important to define these things here because there is confusion among the Ayurvedic fraternity itself whether to call Prameha a diabetes or not, or to label only Madhumeha as a diabetes. I don't know why this confusion is, because Acharya has very clearly mentioned about the things. Prabhut Mutraha Purusha Purvarupahi Upadridi Pramehi Divigyo, which states that Prameh is a state where there is increase in urinary frequency, polyuria, with manifestations of stated prodromal features of Prameh. So the prodromal features, if you see the prodromal features of Prameha, apart from burning in hands and feet, there is clear mention of the sweet urine. Means there is glycosuria. So the Prameha itself is diabetes mellitus. Let us see in the next definition. Sarvayo Prema Mutradi Madhurya Madhubandha Samana Paribhashiki Madhumeha. And not only these, Acharya Sushruta is of the opinion that all the Pramehas can also be called as Madhumeha also. All the Pramehas get sweet taste and odor to sweet blood, etc. So very clear indication. Madhumeha Madhusamam Mehati, diabetes characterized with honey-like urination. Moreover, the clear the point of demarcation between Madhumeha and Prameha given by Acharya Puja is that Madhumeha is a state of Prameha which is associated with complications and carbuncles. So Vatach Prameha, what are the complications mentioned by Acharya Sushruta of Vatach Prameha? If the Prameha is associated with those complications, that is constipation, peripheral neuropathy, etc., then that condition is labeled as Madhumeha. The terminology overlaps as such. Acharya Sushruta is also of the same opinion. Now let us see the modern definition of diabetes, which says that it is a disorder of sugar metabolism where body cannot utilize the blood sugar either due to insulin deficiency, which is mainly observed in type 1, and insulin resistance, which is observed mainly in type 2. In type 2, both things could be there, insulin deficiency as well as insulin resistance, causing elevated blood sugar level. And why so? Because with the help of hormone insulin, cells throughout the body absorb glucose and use it for the energy. Diabetes develops when the body doesn't make enough or it is not able to use insulin effectively, whereas the resistance occurs. Now, for food, what we eat, we get energy from carbohydrates, proteins, and fats. Okay. Let us see little about fat metabolism so that we get the proper idea about the disease. Adipocytes and the liver synthesize triglycerides from non-esterified free fatty acids and the glycerol. Insulin is a regulator for fatty acid metabolism. After meal, insulin promotes accumulation of triglycerides. In starvation and low insulin state, it promotes the lipolysis, and subsequently there is release of FA and glycerol in circulation, which can be oxidized by many tissues. Their oxidation in liver provides energy to derive gluconeogenesis and produce ketone bodies. In small amount, ketone acts as a metabolic fuel, but if the rate of their production exceeds their rate of removal, then hyperketotic state results. What we observe with those persons who observe fasting for more over the period of 1 week or more, then ketone starts coming in their urine. जो लोग आइंस्टाइन पे बैठते हैं उनका कीटोन करते हैं, ये हमको पता है कि उसी वजह से होता है. Now let us see about little about the physiology of insulin secretion. Following food ingestion, glucagon-like peptide, here called GLP-1, glucagon-like peptide 1, incretin hormone, which is also called as incretin hormone, and glucose-dependent insulinotropic polypeptide GIP, here in opters we will call, are released from gastrointestinal L cells and K cells respectively. They act on G protein receptors of pancreatic beta cells, causing increase in cyclic AMP and subsequent insulin secretion by closing the ATP-driven K+ channel. We have seen this in physiology. They also inhibit the glucagon secretion, which increases the sugar metabolism. So, on one hand, it is causing the insulin secretion and inhibiting the glucagon secretion. That's why maintaining the proper sugar level. Now, GLP-1 and GIP are rapidly destroyed, degraded by dipeptidyl peptidase 4 inhibitors. In DM2, GIP cannot modulate glucose-dependent insulin secretion, which is harmful to B cell functioning, altering the insulin secretion after eating. This is one problem we are getting. Then again, glucose enters the pancreatic beta cell via glucose transport, GLUTI, transporters, or facilitated diffusion. Glucose then undergoes glycolysis and oxidative phosphorylation, causing rise in intracellular ATPs. Rise in ATP leads to closure of potassium channels and membrane depolarization, which causes the opening of calcium channels and influx of calcium ions inside the cell, and wherein this promotes the secretion of insulin from the beta cells. When blood glucose levels rise after a meal, the pancreas releases insulin from beta cells into the blood circulation. Now, this insulin stimulates liver for hepatic uptake and muscle tissue fat, peripheral tissue uptake, which is called as, to excess glucose in the form of glycogen. Insulin also lowers blood glucose levels by suppressing the hepatic glucose production. When blood glucose level drop overnight, when we skip meal, usually in night sometimes, then what happens? We doesn't go in hypoglycemia. What happens when blood glucose level drops overnight due to skip meal or heavy exercise? The pancreas releases glucagon into the blood, which is from the secreted alpha cells, and raises the blood glucose levels. Glucagon signals the liver, kidney, and muscle tissue to break down glycogen into glucose, which enters the bloodstream and raises blood glucose levels. If the body needs more glucose, glucagon stimulates the liver to make glucose from amino acids also. So primarily it maintains the blood sugar level if it drops down. Just a minute. Types of diabetes as per modern science: type 1, which was previously called as insulin dependent diabetes mellitus, which usually begins at the early age, and type 2, which was previously called as non-insulin dependent diabetes mellitus, which usually begins after the age of 40 and in obese individuals. In between these, there is 1.5 diabetes, which is called as LADA, latent autoimmune diabetes, which is like type 1. Another is gestational diabetes, which is observed during the pregnancy. The types of Madhyamena as per Ayurveda, Acharya's clearly mentioned there are two types, which is like type 1 and type 2 classification as given by modern science. The Sahajo, which is due to genetic predisposition from inherited from mother and father, that is type 1 type, and Apatyanimito Stulaha, which is due to consumption of this more consumption of carbohydrates and sugars, and because of sedentary lifestyle, etc. Those things. And similar type of one more similar type we've observed, that is Krusha Paridrubal Prameh, which resembles the type 1, and Sthul Balwan Prameh, which resembles the type 2, obese patients. What we observe. Type 1 diabetes is an autoimmune disease where the body's immune system attacks and destroys the beta cells, causing insulin deficiency. Type 1 diabetes typically occurs in children and young adults, but can appear at any age. In the past, type 1, I already told you, it was called as IDDM. LADA may be developing kind of type 1 diabetes only, and the diagnosis usually occurs after the age of 30, LADA, which is misdiagnosed as type 2 diabetes most of the time. If you see the causes of type 1 diabetes, we see the genetic susceptibility. This is mentioned in our science also, Sahajo Matrupitru Bija Dosha Prataha. Autoimmune destruction of beta cells by white blood cells, environmental factors such as food and toxins, viruses and infections, Coxsackie virus, cytomegalovirus, adenovirus, rubella virus, mumps, which may possibly trigger the autoimmune response in susceptible individuals. Infant feeding practices, breastfed infants and infants receiving vital supplements may have reduced risk of developing type 1 diabetes. And we also encourage the breastfeeding. While early exposure to cow's milk with cereal proteins may increase the risk of developing diabetes in type 1 diabetes. Whereas type 2 diabetes is caused by a combination of factors. The etiology is multifactorial, including insulin resistance, a condition in which the body's muscle fat and cells do not use insulin effectively, or with hyposecretion of insulin. See, when there is resistance to the insulin, there is a signal to pancreatic beta cells to produce more insulin. And when it produces more insulin, but which is again ineffective, then pancreas decreases the secretion of insulin. And that's why there is hypoinsulinemia, hyposecretion of insulin. So it develops most often in middle-aged and older people who also are overweight or obese. Symptoms of type 2 diabetes may develop gradually and may remain undiagnosed for years. Sorry for the disturb. I was getting disturbed here with the noises around. So 1.5 diabetes, around 15 to 20% of patients of latent autoimmune diabetes at type 1 adults are misdiagnosed as type 2 diabetes, and medicine designed to reduce insulin resistance does not act in LADA. They eventually require insulin to control the diabetes. Average after within the 4 years. They do not have typical type 2 symptoms. They have low risk for coronary artery disease once sugar is controlled. Gestational diabetes is because of hormonal disbalance and metabolic demands of pregnancy, either with genetic and environmental factors. And these once the baby is delivered, these hormones come to the normal level, and in most women it disappears. But the women who are having genetic predisposition for it and likely to have this type of diabetes in future. That's why every monthly after delivery they should be tested for 2 to 3 years, just for a screening purpose to keep the eye. The causes of type 2 diabetes are genetic susceptibility. The TCF7L2 gene increases susceptibility to type 2 diabetes. Genes can increase the risk of diabetes by increasing a person's tendency to become overweight or obese and tendency to store energy. This is, and actually we have got it from our genes. In the earlier times, there was a tendency, because of the starvations, there was a tendency to store fat in the body. And that's why the Indian individuals got this tendency from inheritance. And that's why our tummy is, gets enlarged. Obesity and physical inactivity, they are the main causes, and particularly the central obesity, which the person has excess fat on the belly, which is a major risk factor for insulin resistance, as it induces the inflammation process. And in our science also, the Medavruddhi Lakshanas, they have been told as the Lambanam, and that is the triggering factor, one of the insulin resistance. Muscle fat, liver cells stop responding properly to insulin. And to compensate this, pancreas produces extra insulin, but ultimately, as I told, when this remains resistance, it stops secreting the insulin, and patient goes in hypoinsulinemia. Abnormal glucose production by the liver. High glucagon levels for unknown reasons in diabetics cause the liver to produce unneeded glucose. The glucagon secreted from the alpha cells. This its level may be raised, is raised in diabetics. So risk factors for diabetes: age 45 or older, overweight or obese, physically inactive persons, particularly the doctors, the teachers who remain seated throughout the day and doesn't carry any exertional activities or do not exercise. Parents or sibling with diabetes, hereditary disposition, history of giving birth to baby weighing more than 4 kg, and having history of gestational diabetes. High blood pressure or being treated for high blood pressure. You see, the beta blockers, especially if one takes the atenolol for 6 years, it may induce diabetes in 10 to 20% cases. Although they have identified one culprit, atenolol, but I tell you, all the antihypertensives, they are having the potential for developing, for giving rise to the diabetes, type 2 diabetes. Statins, what one takes for to treat the hypercholesteremia and for weight reduction purpose also, they also contribute, and which is quite oftenly prescribed after ischemic heart disease event, and they are the cause of type 2 diabetes in 20 to 30% of the cases. Vitamin D deficiency also, because those who particularly enjoys AC environment, lives in cold places, and doesn't take the sun bath. Other risk factors, high density cholesterol, which is good cholesterol, value below 35 mg per deciliter, triglyceride level above 250 mg per deciliter, polycystic ovarian syndrome, which is observed in obese individuals, pre-diabetic condition, wherein HbA1c level 5.7 to 6.4%. These pre-diabetic individuals, they are prone to go into the type 2 diabetes after say 7 to 8 years if they do not maintain. And history of coronary vascular disease, acanthosis nigricans, which is a condition associated with insulin resistance characterized by dark and velvety rash around the neck or armpits. Now see what is given in our science also, the same thing. Divasapna, Avayam, Alasya, Snigdha Madhu, Nidya Dravya, Annapan leads to Prameha. Navadhanya, Sura, Anupmas, Ikshu Gud, Ikshu is sugarcane, Buddha is Jaggery, again the sugar in consumption. The famous Shloka Navannapanam Sarvam. Again, Diva Swapnam, day sleeping, Avayam, lack of exercise, Alasya, laziness, and this consumption of Madhuram, Lavan, Shita, Snigdha, Guru, Pichil, etc., the Krishara pies, and all these substances made from the milk and milk products and the sweet and sweet products, they causes the variation of kapha and therefore the rise in sugar. So lack of exertion, high calorie diet, as per Ayurveda also. Metabolic syndrome, they are patients with metabolic syndrome, they are prone to go into type 2 diabetes. It refers to a group of condition common people with insulin resistance, including higher than normal blood glucose levels, increased waist size due to excess abdominal fat, high blood pressure, abnormal levels of cholesterol and triglycerides in the blood. People with metabolic syndrome have an increased risk of developing diabetes and cardiovascular disease. Many studies have found that lifestyle changes such as physically active, losing excess weight are the best way to reverse metabolic syndrome. This metabolic syndrome or pre-diabetic state can be reversed with the adoption of proper lifestyle and dietary factors. This I witnessed in many cases. The causes of metabolic syndrome as per Ayurveda is the same: the lack of exercise, day sleeping, excessive intake of fatty substances, excessive intake of alcohol, and this is proved beyond doubt. Features they are mentioned: pendulous abdomen, exertional breathless, breast enlargement, buttock enlargement, cheek enlargement, thigh enlargement, calf enlargement, lack of energy, improper metabolism, increased sweating, increased thirst, and sweetness of mouth. This is pre-diabetic state. Let us see the pathophysiology. One is the problem in cell signaling and regulation. There is one important point in this below. We will see which could hold a key to success in future. Interaction between circulating insulin and its receptor molecules on the cell prompts the biochemical signals that enable the cell to absorb glucose from the blood and use it for energy. Now, researchers had found the pathways that transmit the insulin signal and how map interaction between insulin and body tissue. Also found key signals also come from fat cells, which produce substance causing inflammation and insulin resistance. And now this could be the key. If we could stop this inflammatory response with some or other drug, we could find a cure for diabetes. Another thing is beta cell dysfunction. Beta cell impairment can cause inadequate or abnormal pattern of insulin release and is a key contributor in the development of diabetes. That I had already told you. And in turn, beta cell itself may be damaged by high blood glucose levels, and which can be called as glucose toxicity. And another is proposed genetic defect. The metabolic environment of the developing fetus may also give a predisposition for diabetes in later life. Dushas involved in Prameha as per Ayurveda, this Medamasa Kleda, Shukra, Shomit, Vasa, Majja, Lasika, Rasa, and Puja. These 10 famous dushas are there, which in body fat, muscles, water content of the body, semen, blood, visceral fat, lipids in the bone, lacteal, plasma, and essence of all nutrients. Almost everything gets affected. And the pathophysiology, as told by Acharya Sushruta, those who consume the kapha provocative diet and lifestyle, and Adyan Shila, who is engaged in study, Avyayamino, means who do not exercise, who observes day sleeping and consumes sweet substances and high carbohydrate substances, then that causes the atistolya, that is obesity, which is the first step in this thing, and that ultimately leads to the prameha. And tasya utpatti pariyate. What is the process to prevent it? To avoid the precipitating causes. Tasya utpattim pariyate. And if it is, if one got it, then one should employ the therapeutic measures like like Shilajatu, Gugulu, Gomutru, Trifala, Rasanjan, and these are the medicines, and the dietary things like Madhu, Yava, Mudga, Pordu, Shama, Puddalika, Dinam. These are the varieties of jawar, means these grains which are low in glycemic index. We will see that when we will see the prevention of diabetes. Virukshan Chedaniyanam Dravyanam Vidhivat Vyayamo Lekhan Basti Upayog Lekhan Basti, and exercise is then sites. And Rukshandra Vaz and Chedani Vaz, they have asked to prevent the complications of prevent the prameha and its complications. Pathophysiology, again, why I'm telling by giving the views of 2-3 acharyas. Charka is of the view that the water content of the body gets mixed with kapha and meda, and on reaching the bladder, it is passed frequently as urine. So they have used the terminology which was prevailing in those days, what we call glucose, and in terms of carbohydrates, etc. This excessively increased kapha and meda, carbohydrates and lipids, and sugar is a metabolism of defect of carbohydrate metabolism. Draw more water to make its concentration like surrounding tissue and is expelled out of the body, which is exactly like when the urine contains blood contains a lot of sugar, then it absorbs the water to make you dilute, and then again it is expelled out of the body. The aggravated vata in Vata Prameh, by traversing the whole body, squeezes out the fat, Metu Majjavasa, and brings out through the urine in the form of sweet urine. Again, Acharya Charka is of the view that excessively increased kapha, pitta, meda, mansa leads to the obstruction of vata, due to which aggravated vata brings out the oja into the bladder and gives rise to the madhumeha. One more pathophysiology. The vitiated kapha on one hand transforms the body water into urine, and on second hand, on the other hand, it gets permanently lodged into the microvasculature of the kidney and urinary tract, and thus gets which is already overloaded with water and lipid content, leading to chronicity and incurability. This is the cause of reason for diabetes getting chronic and incurable. So let us see the syndrome. Central features: polydipsia, polyphagia, lethargy, stupor, systemic weight loss, eyes may be blurred, breath there may be smell of acetone, gastric features like nausea, vomiting, abdominal pain. On raising the sugar, we find this urinary polyuria and glycosuria. These are the things which we observe, which is given in our definition also. Respiratory, Kussmaul's breathing, hyperventilation may be found in diabetic ketoacidosis particularly. Now let us analyze these syndrome. Prodromal features of prameha. In prodromal features itself, the acharyas has clearly mentioned, Bhavishyato mehagada sirupam mutraha abhidhavanti piplika. There are ants to the urine of diabetic individual because of glycosuria in it. And there is karpadadaha, burning in talking and glowing type of anesthesia may be there, or burning sensation may be in that area. Galatalushosha, dryness of throat because of excessive urination. So, and syndrome of Ayurveda, polyuria, increased thirst, dryness of throat, lethargy, sweetness of mouth, hands to urine, glow and stalking burning, lack of energy. And the Acharya Susmita has mentioned what type of lethargy is the diabetic individuals are having. If you ask the diabetic patient to walk, he or she will like to sit. If you ask them to sit, they will like to lie down. And if you ask them to lie down, they will like to sleep. Such is the kind of lethargy because of increased blood level of sugar. Now, this is why there is weight loss in diabetes mellitus. Because in people with diabetes, insufficient insulin prevents the the body from getting glucose from the blood into the body cell to use it as an energy. And when this occurs, and when body cannot get the sufficient amount of energy from this glucose, body starts burning the fat and muscle to derive the energy. Now this muscle loss, it causes the reduction in overall body weight. That's why there is a weight loss. And that weight loss is mentioned as a complication of Prameh in our science also. Why there is burning sensation in the hands and feet? Because the resultant neuropathy, which is the cause of burning. Damaged nerve fibers are more likely to become overactive and misfire. They say no wound or injury. The leg nerves become damaged first. These people often complain the tingling and numbness in the feet, as well as they can have varying degrees of burning pain. Karpadayo suptata dahu. Both words. They can, suptata means the tingling or numbness sensation, and daha, burning sensation. Why there is polyuria? We have already seen that because of this hyperglycemia related increased glucose concentration in the body, expels this extra glucose through urine. As urine is loaded with glucose, becomes concentrated, and through which osmotic pressure pulls more water in the urine to keep it diluted. Hence, there is polyuria. Prabhutavil mutrata, Prabhut mutra lakshana sarvapi. That is mentioned in our science also. Why there is polylepsia? Because of this, because of polyuria, there is signal for intake of water. Although the diabetic drinks more water to quench the thirst, water is quickly excreted in urine in order to expel the extra sugar, and still the cells lacks in sufficient water, and again and the vicious cycles goes on. They shikanada they trut swadvasan joy. Trut stands for Krishna. Why there is polyphasia? Who क्यों लगती है बार-बार diabetes को? Due to insulin resistance in diabetic patients, glucose cannot enter the cells despite high amount of sugar in the bloodstream. The stellar starvation of glucose signals the brain abnormally to have absorption of glucose depleted state, as a result of which brain arouses the desire to eat. Means despite there is a sufficient amount of sugar in the blood, body cannot utilize it, and then again brain sends the signal that body's glucose depletes because the cells are not getting it into it, although there is sufficient sugar in the blood circulation. But as it cannot be utilized, it sends the again signals for to have it, and then again there is a desire to eat, and the vicious cycle goes on. Why there is coma? The brain has little capacity to store energy in the form of glycogen. The blood-brain barrier does not allow the fatty acid to enter the brain. Entry of glucose into the circulation is mainly from liver. Brain depends on liver for constant supply of glucose for oxidation and the generation of ATP, which is the energy molecule. When there is severe depletion of blood sugar, brain is deprived of the fuel for generating ATPs, and the resultant coma is there. Let us see modern way of diagnosing these diabetes test. Random blood sugar. If the random blood sugar level more than 200 mg per deciliter or higher suggests diabetes, is especially coupled with the signs and symptoms of diabetes, which is frequent urination and extreme thirst. Fasting blood sugar test. A fasting blood sugar level more than 125, 126, 120 is pre-diabetic state, and more than that 126 on two separate occasions suggests the diabetes. Post-meal blood sugar after 2 hours of meal. If it is 140 to 150, in between 140 to 150 mg per deciliter is pre-diabetic, and more than 150, you can label a diabetic one on two separate occasions. Our HbA1c level more than 6.5 can safely be labeled as diabetic. And the criteria in Ayurveda given: the state where the prodromal features of prameha becomes evident and frequency of urination increases, called as prameha. And the prameha, when associated with complications like carbuncles, polyphagia, muscle pain, stiffness, tremors, constipation, that state is called as madhumeha. So the pre-diabetic state and the diabetic state that can be diagnosed clinically in Ayurveda also. And the laboratory diagnosis as suggested by Ayurveda is Shatpat Pipilkabhisham Sharir Mutrabhisaranam. If there are ants to the body, it indicates the raised blood sugar. And if there are ants to the urine, it indicates the raised urine sugar. And supported by clinical features like sweet mouth taste, sweet body odor, coated body, thirst, polyuria, dryness of throat, feeling of numbness. That is actually the concept of laboratory diagnosis. Shatpat Pipila Sharir Mutrabhisarana in Ayurveda. You can see in the slides this ants to the body and ants to the urine here. The pulse diagnosis mentioned in Nadi Tantra, the pulse is 3D in diabetic individuals. Oral glucose tolerance test. For this test, unrestricted carbohydrate diet is given for 3 days. Then patient is fasted overnight and fasting sample is measured. Then 75 gram oral glucose drink is given and reading is taken after 2 hours. On blood sugar level less than 140 mg per deciliter is normal. Reading between 140 to 200 mg per deciliter indicates prediabetes, and reading of more 200 mg per deciliter or more indicates diabetes. Now, they also use this criteria in the diabetes reversal program. Once they give medicines for 3 months and they reverse the diabetes, then they perform the oral glucose tolerance test. Glycated hemoglobin HbA1c test. This blood test is indicative of average blood sugar levels for the past 2 or 3 months. You see, the average survival of RBC is 120 days. And this for that purpose, these 3 months counts can be taken into consideration. It measures the percentage of blood sugar attached to hemoglobin. The higher the blood sugar level, the more hemoglobin one shall have with sugar attached. Normal levels are below 5.7%. Result between 5.7 to 6.4% is pre-diabetic, and HbA1c level above 6.5% on 2 separate occasions indicates diabetes. Prevention is all about the minimizing the risk factors, healthy balanced eating, that is just enough calories to maintain the healthy weight. In diabetic reversal program also, they just adjust the calories, daily calories, and the regular exercise for minimum of 30 minutes daily, 5 days a week. Maintain ideal body weight, aim for body mass BMI, body mass index between 18.5 to 25. Blood sugar monitoring, and these steps can help in maintaining the normal blood sugar and can further prevent the complications or delay the complications. Now we will see the prevention of diabetes as risk factor wise. Now what is given in our science also and what is observed in modern science also. Risk factor number one, overweight or obese. Acharya Sushita has mentioned these Stula Bhavanshis, Nimnashas, and also Prashila Pray. They are obese patients most of the time. I mean, type 2 diabetes is observed most of the time. And reduce weight by survey which Pariharu, Sovirak, Tushodok, Shukta, Maria, Sura, Aso, Toya, Paya, Telash, Guta, Ikshubikar, Dadi, Pistan, Namla, Yava, Gupanakani, Gramya, Mansani. So, in nutshell, this side we will discuss again in subsequent slide also. The low calorie diet, alcohol restriction, intake of foods and foods with low glycemic index, burning the calories with exercise, which is advocated by the Acharya Sushruta. Foods to be avoided in GM, these alcoholic drinks, Sura, Sovic, Maidarak, all types of alcoholic drinks to be avoided because alcohol, we have Acharya said, Varaya Pushanti, but the Varaya Pushanti, because alcohol causes fatty deposition in the liver and in the body. So that's why it should be avoided. Sweets, chuvikar, milk, dairy, or the dairy products, paya, gruta, dadi, these milk oils in restricted quantity, flour and cereal pulses, pishtana, the grains and the wheat, etc. Those should, the pishtana should be avoided. Paste of sour food, amla yawagu should be avoided. Non-veg food, as they contain high fat. They should be avoided. Sweet beverages, panaka should be avoided. The same thing is mentioned in modern science also. Food grains to be used as shalishastic rice, old barley, old wheat, and the kodrava, uddalak, shamak, kodrava and uddalak, the varieties of jawar, shamak, shama chawal, that resembles to what is commonly said is bhagar in Maharashtra. That nivar, this type of things, they are all available on Amazon now, and people are now using it more often. Leafy vegetables that to be used by diabetics are giloi, chaulai, poi, methi, palak, chaupatiya. And the bitter fruit vegetables, panwad, padwad, baigan, karela, lauki, tondle, all gourd, all bitter gourds, they can be used. It is important to center the diet on high fiber, low fat foods, whole grain, fewer animal products, refined carbohydrate, and sweets. The glycemic index is a measure of how quickly a food causes rise in blood sugar. Food with high glycemic index raise blood sugar quickly, and low glycemic index food help in achieving a more stable sugar. That's why the foods, they have a very important role in maintaining the blood sugar. Foods with low glycemic index should be used because of its high fiber content. Healthy carbohydrates, focus on the healthiest carbohydrates such as apple, fruits like apple, watermelon, jamun, vegetables like palak, methi, tomato, bindi, baigan, gobi, karela, lauki, which can be commonly used in diabetic conditions. Whole grains, legumes, matki, mung, they are low. They have low glycemic index also, and low calorie also. Low fat products like buttermilk can be used. Buttermilk with haritaki, especially after food, is very useful. Fiber rich foods, fibers can decrease the risk of heart disease and help to control the blood sugar levels. This which tela should be used, we will see in next slide. Saturated fats, this to be avoided. High fat dairy products, animal proteins, they should be avoided. Trans fats, which are observed in snacks, they should be avoided. That bread, butter, bread, etc. Cholesterol, high source of high fat dairy products, they are the richest source of cholesterol. High fat animal proteins, they are also the source of cholesterol. Egg yolk, shell, the yellowish part of the egg, shellfish, liver, and other organs of the meat, they should be avoided. Sodium should also be taken in little quantity. Now see here, how many calories most of the people, they reverse diabetes through calorie management, and the wheat flour per 100 gram. Urad dal, tuvar dal, barbati, kulthi, and rajma. Rajma being the highest one per 100 gram, it gives 658 calories. Wheat flour gives 339 340 calories. As you compare, if you compare it with the moong, which gives only 30 calories. That's why moong and matki dal is very important in the management of diabetes or prevention of diabetes. Now, which oils should be used? Acharya Sushruta, why Acharya Sushruta has said that only the sarshap, atsi, and the ingudi telas should be used. The reason being, this is the very bad saturated fat percent of the sesame oil is 14, mustard oil is 13, soybean oil is 15, flaxseed oil being the lowest, 11 only. And almond oil, 8, olive oil, 14. These are not used, but generally the soybean oil, peanut oil, and the sesame and mustard oil, flaxseed oil are used in our country. So flaxseed oil in summer and mustard oil in winter and sunflower oil in rainy season, that will be the better thing to follow. And if you see the saturated fatty index of palm oil, 52. And from where we transport from Malaysia. In Malaysia, there are 40% individuals suffer from ischemic heart diseases because of this, because they use the palm oil in their diet. And now the reason being in India also, as I said, the type 2 diabetes have multifactorial etiology. What we consume regularly, the samosa, dosa, uttapam, whatever is, those are all fried in 5-star hotels. So they are all fried in palm oil. And even if you bring the branded oils at your home, there is allowance of 40% adulteration of it from government side. So it contains 40% adulterated palm oil. That's why we all are getting, and that's why we should cut down the fried things. Rather prefer for roasted one. The roasted papad should be preferred instead of fried papad. Likewise, you can, and even if to use oil in the preparation of the veg, one should not use it above the 1 tablespoon. Ghee, nariyal tel. You see the nariyal tel, where in the Kerala and in Tamil Nadu they cook it in nariyal tel, and they are the highest rate of type 2 diabetes. Saturated fatty index of coconut oil is 92%. Sunflower can be used, is 11, as like flaxseed only. Acharya Sushruta has clearly mentioned for diabetic individuals which tela should be used: ingudi, sarshap, and atsi. And reason being is this: if you verify the rationale given by acharyas by modern study also, it becomes the same. Risk factor to physical inactivity. व्यायाम योगे ही विविधि आसन समिति में आचार्य चरका said कि the individual who regularly performs the exercise do not get the diabetes. And प्रवृत्त में हाथ व्यायाम युद्ध क्रीड़ा गज तुरग रथ पद्धतिचर्या परिक्रमा अन्य अस्त्र उपास्त्र व संवरण. So if one suffers from diabetes, he should have the exercise, different type of exercise modalities like yuddha, krida, gaja, turak, paddhaticharya, means pedal walking. Like Acharya Sushruta had said, had given it by class wise for higher society, lower society, middle society. Itram khanetva kupam. Acharya Sushruta had asked to dig a well for 1 year by a single diabetic person. So much of the exercise he had asked to carry out. Daily exercise for 30 minutes, 6 kilometers walking and running, if possible, at least 5 days a week, makes sufficient. Principles of management as per Ayurveda: व्यायाम योग ही विदहि प्रगाढ़ ही उद्वर्तन ही स्नान जलाव सेक ही सेव्यत एला गुरु चंदन आद्य ही विलेपन ही चाशु न संति मेघा. So prevent diabetes. Different types of exercise: deep massage, water bath, cream application of sandal, heat sun bath. These can be followed. Walking reduces obesity. Those with high income group having increased sugar level should exercise in the form of wrestling, playing, elephant riding, horse riding, etc. Those with low income group should walk as much more than 100 yojan in daily division. Rest others should dig well in 1 year by themselves. This is the exercise advocated by Acharya Sushrita. We can formulate as per today's era. These are the exercise modalities advocated by Acharya Sushrita. Physical activity lowers the blood sugar. Plank is one more important exercise which is very useful in diabetics, and it reduces the diabetic insulin resistance and regulates the insulin secretion. So it must be done. Prevention of diabetes, risk factor number 4, triglyceride level above 250. Avoid alcohol and the consumption of alcohol, it drastically increases the triglyceride levels. So acharyas have suggested that to reduce the alcohol consumption or completely abstain from it, and avoidance of day sleeping. And for this and for low vitamin D status, acharyas have asked to take the sun bath. In earlier slide, we had seen here acharyas said snana jala avaseka hi, sun bath avasek. The treatment principles, the स्थूल प्रमेहि बलवान ही कई कृशस्य तैक परिदुर्बलस्य संब्रहण तत् कृशस्य कायम संशोधनम बलादोष बलाधिकस्य. So in obese patients, Acharya is asked to do the apatarpan therapy and the shodhan therapy, and in the krusha patients, the thin and lean patients, Acharya is asked to nourish it because some or other time these patients will require the nutrition to fight the diabetes. The drugs which can be used in combination, singly, or in various other dosage forms, that could be Priyangu, Lodra, Neem, Saptaparni, Arjun, Amra, Jambu, Asandiste, Vijayasar, Haridra, Tripla, Patha, Vidanga, Khadir, Chandan, Guruchi, Ashwat, Ajakarna, Ushir, Musta, Patul, Indra, Palash, Devdaru. The list is a lot, and this can be used in various dosage forms. Specific treatment, Acharya has advocated the use of Shilajatu up to 100 pal, which should be increased gradually to actually it is the Vardhaman Shilajatu and the Salasaradi Gan Bhavit. The bhavana of the drugs containing Salasaradi Gana should be given to the Shilajatu, and that Shilajatu can be consumed in 100 per quantity, but 100 per quantity will be big. I think it should be gradually increased. Another is Swarnamakshik or Ropamakshik Bhasma. Tuvarak still is considered to be the best for diabetes mellitus, but there is controversy regarding this Tuvarak, what the Tuvarak is, whether it is found in coastal belt like Konkan, that Nariyal like fruit, that is Tuvarak or other thing. That is still there is controversy. Still there is controversy. Vasakanta Kusumkar Ras could be used to treat the diabetic complications like peripheral neuropathy, particularly when one suffers from impotency. This Vasanta Kusumkar Ras can be used. Branded Ayurvedic oral hypoglycemic agents are Hyponid from Charak. These are diabetic compound Himalaya, BGR30 from Emil. BGR34 is developed by CCRS, and the other things you can Madhu Mardan, Madhu Workshop, you can also see the things, but you see they are useful up to 200 to 230 post meal blood sugar. After that, it is observed that they act as an adjuvant only, but not as a first line of therapy. Control of diabetes, my approach, what I use in my patients, what I suggest them, pre-diabetics is dietary modification and lifestyle modification, as we discussed earlier. Morning glass full of lemon water plus little honey when you wake up and go away for the morning walk. Then have Gomutra 15 ml on empty stomach, or even these Kumari Swaras can also be used. Herbal tea, in that herbal tea, jeera, sarso, dhania, haldi, tulsi, adrak, this should be used. And in food, when you take food, garlic ginger paste in the form of chutney should be added to it. Both garlic and ginger, they are useful in relieving the resistance, insulin resistance, and regulating the insulin secretion. There are a lot of studies have been done on the role of garlic and ginger, and they are found very useful. And this particularly the garlic, it also maintains the blood pressure. After food, we soft the flax seeds, shunti powder, and just a combination of this thing. Many people, they eat gutka instead of gutka. You make the combination of these things and have it. So this is for pre-diabetic. And mild diabetics, those who have 170 to 200, then same things can be with, and the medicine you can give hyponate or BGR. With this is absolutely fantastically controlled. And if you don't want to use hyponate or BGR, then do one other thing can be done is to cut the wood of Vijayasar into pieces of 2 into 2 inch, and use that 2 into 2 inch piece for 3 months. It is active for 3 months. Dip that piece in water for overnight. Keep that water in copper pot, copper utensil, and keep it for overnight. And you divide it in 3 doses, 1 glass each. 1 glass in the morning. If you have sugar up to 170 200, 1 glass in the morning, that is sufficient. What I observed my patients, and with this regimen, they hardly require other thing. The mild to moderate diabetics. Now here with the earlier set regimen, now here this Vijayasar fund, you can use twice or thrice. Means at 8 o'clock you can have 1 glass, at 2 o'clock 1 glass, and night 8 o'clock when you can have 1 glass of that hema. If you need more potency, you can this Fanta also, decoction also. And if you are not happy, the sugar is going to about 250, you can add the arjun chal in it. And the method is same of preparing hema or Fanta, and that satisfactorily controls the blood sugar. This is the same thing. Now above 300, with the earlier said regimen, you require a modern drug treatment. The suitable choice for obese patient is metformin to start with, 500 mg BD. For thin patients, we use sulfonylurea, glimepiride, and uncontrolled cases, insulin, human actrapid or mixtard. But you see, whether you start metformin or glimepiride, they satisfactorily control the sugar for 2-3 months, and after that again you have to make a combination or add other drug to it, because the nature of the body is such that it makes everything satmya. After for some time it acts the drug, thereafter body makes everything. There is adaptability. Adaptability is the nature of the body. That's why then elevated blood sugar doesn't respond to these drugs. So Sneha, do we have a little more time so that we can discuss the modern aspect also, modern treatment aspect also? We have.
Yes, sir. We can do within 10 minutes.
Fine. So I will discuss this in first, and then we'll summarize the things. Okay. So from the recognition of diabetes mellitus by the ancient Greeks until the only treatment for this condition was strict dietary modification. In 1920s, see how late it was, with the isolation of insulin from the animal pancreas by Banting-based polyp and bacteria. Insulin injection proves life-saving for children affected with the type 1 diabetes and cause miraculous recoveries. In 1950s, the first biogonoid that was discovered was fenformin and tolbutamide acylphosphorylurea for the treatment of type 2 diabetes. And then after, okay. So when to start this biogonoids and for whom to start? This is metformin by and large remains still is the preferred drug to start with. In obese patient, it reduces hepatic glucose production and increases peripheral glucose utilization. It decreases the peripheral resistance for glucose. In altered kidney function, metformin is retained in kidneys, worsening the kidney failure. For this reason, when in ICU patients, OHs are not given, they give the insulin. And for in illnesses also, which runs for weeks, or in chronic illnesses, one should avoid metformin. And insulin should be given rather to control the blood sugar. Sulfonylureas stimulate endogenous insulin release by closing potassium channels. They squeeze out the pancreas. Gliclazide, glipizide, glimepiride, clavinclamide. Clavinclamide once was used like in the first line therapy, downhill, very famous drug. Now, the possible side effects are hypoglycemia and the weight gain. So metformin reduces the weight, and sulfonylurea promotes the weight gain. The combination can also be used, and most the people they use the combination. Glimepiride is now into most common practice, although all are meglitinides. These are the agents in this which stimulate endogenous insulin secretion by closing potassium channels in the beta cell, and like sulfonylurea. Weight gain is a possibility like sulfonylurea. The short half-life of the meglitinides results in lower incidence of hypoglycemia that is seen with the sulfonylureas, which is an advantage in elderly patients and those with the coronary artery disease. Eripaglinide, netaglinides are the examples. Thiazolid dinadiones are there. They are like metformins, which make the body tissue sensitive to insulin. They reduce peripheral insulin resistance primarily through an action on adipose tissue. There is evidence that TZDs may persevere cell from ongoing deterioration. This class of medication also linked to the weight gain and more side effects such as increased risk of heart failures. So pioglitazone, because of this risk, they are now no longer used nowadays. One more class, alpha glucosinase inhibitors. This is used. They inhibit the hydrolase enzyme that catalyzes the decomposition of disaccharides into monosaccharides in the intestine. Thereby, it delays the digestion and absorption of carbohydrates, resulting in improvement of post-meal hyperglycemia. It delays the absorption of carbohydrate. Example is Hoglipose. Some are incretin mimetics. The intestinal hormone glucagon-like peptide has multiple effects, including stimulation of insulin secretion, suppression of glucagon levels, slowing of gastric emptying, and early satiety effect. Exenatide and liraglutide are the examples of GLP-1 receptor agonists, and the possible side effects include nausea and increased risk of pancreatitis. They are also guardedly used. DPP-4, these are now widely used. They are incretin enhancers, incretin hormone, how it regulates the blood sugar. We have seen in the first two, three slides. GLP-1 is rapidly degraded in the body by the enzyme dipeptidase 4. The DPP-4 and actually these DPP-4 inhibitors, they inhibit this rapid degradation. And these agents are used primarily as an adjuvant to metformin therapy, resulting in less hypoglycemia than the sulfonylureas and no weight gain and fluid retention, such as seen with the TZDs. Now they are rapidly being used in combination, and most common combination what we observe today is the galvosmet, in which vildagliptin 50 mg and metformin 500 mg is used. SGLT2 inhibitors, sodium glucose transport inhibitors. These are the newest diabetic drugs in the market. SGLT2 is a protein in humans that facilitate glucose reabsorption in the kidney. These inhibitors block the reabsorption of glucose in the kidney and increase the glucose excretion in the urine and lower blood glucose level. Since the excretion of glucose only occurs at serum levels above normal, sodium glucose transporters inhibitors do not cause hypoglycemia, since they are preferred. Examples include canagliflozin and dapagliflozin. Side effects include yeast infections, as the more sugar is passed in the urine, and urinary tract infection. So insulin therapy is at some or other point failure with all the treatment regime. As I mentioned, there's body's tendency to adaptability. At some or other point, insulin dose may be required, and in turn, the adaptability can occur. This also, and the dose may go on increasing also. In past, it was used as a last resort, but nowadays it is preferred as a first-line therapy in some individuals. The simple formula is 0.55 into weight that gives the average daily insulin requirement. There are a lot of insulins there: insulin, glucine, lispro, aspart, glargine, isofen, and regular sliding scale for this type of blood sugar, 70 to 130 and 131 to 180. You can see the 2 units, 4 units, 8 units, and above 300 low dose scale 8, moderate dose is 12 units, and high dose is 20 units. And accordingly, these as per this sliding scale, the insulins can be administered. Bariatric surgery is now becoming popular. Many the Rajnit political persons, netas, they are doing it bariatric surgery, which is a ray of hope for completely curing the diabetes, almost 95% of the time. But to maintain it, additional drastic lifestyle changes are required. Hyperglycemia. There are some signs of trouble, which includes symptoms like frequent urination, increased thirst, dry mouth, blurred vision, fatigue, and nausea. So give the drug and adjust the diet accordingly. Low blood sugar. I always tell your patient that if you feel sometimes giddy or have a slurred speech or altered consciousness, take the whatever available sweet drinks with you, or keep the glucose biscuits with you. Have plate bearing that you are diabetic. These are things could be done, and if you are in hospital, then 25% dextrose infusion can be given to correct it, or even sometimes injection of glucagon in dire emergency can also be given to raise the blood sugar. Another one condition is hyperglycemic hyperosmolar non-ketotic syndrome, HHNS. The signs and symptoms include life-threatening, the increased blood sugar as much as 600 mg per deciliter, dry mouth, extreme thirst, fatigue, drowsiness, confusion, vision loss, hallucinations. And the glucometer may show just only high. And most commonly it occurs in the old age peoples with type 2 diabetes, and possibly with illness or infection. Diabetic ketoacidosis is again one condition. When the cells are starved of energy, body may begin to break down the cells. This produce toxic acids known as ketones, and which can give rise to thirst, dry mouth, frequent urination, vomiting, shortness of breath, and the fruity smell to the breath. This because of ketones. And check for the excess ketone bodies in the urine. And this condition is more common in people with type 1 diabetes as compared to type 2 diabetes. And this is also often preceded by illness or infection. Complications of diabetes, neuropathy, retinopathy. In neuropathy, you can see retinopathy causing blindness, nephropathy causing kidney failure, diabetic foot leads to amputation of foot, diabetic gastropathy. Because of that, there is great constipation in diabetic individuals. Diabetes and heart complication, ischemic heart diseases can occur with deposition of fat in microvasculature. Complication as per Prameha, as per Ayurveda, polydipsia, diarrhea, fever, weakness, digestion, gangrene, carbuncles, abscesses, chest stiffness, greed for sweet, stiffness, tremors, neuralgic pain, and the constipation due to gastroparesis. So these are the same as mentioned in modern science also. And as I already told in the very outset, that Ayurveda is the only science who says that diabetes can be cured. And such a who is cured from diabetes, the features of patients cured from diabetes given by Acharya Sushruta, when the patient of Prameh passes the clear urine without cloudiness, devoid of sweetness and stickiness and turbidity, then he or she is said to be free from Prameh, or his or her disease said to be under control. The earlier parameter, the only parameter to observe this was the urine. So nowadays we can measure the HbA1c levels and the blood sugar levels. For this, prognosis, as we find, as given in Ayurveda, the same. The juvenile diabetes type 1, Jat Pramehi, and diabetes running in families is not curable, and other type 2 diabetes is curable. That is what mentioned in our science. Other bad prognostic indicators mentioned in Ayurveda is the patient of Prameh who is associated with burning, thirst, carbuncles, gangrene, and diarrhea, altered consciousness, necrotizing skin infections, which is very commonly observed in diabetics, gangrene, fever, hiccups, dyspnea, and weakness, is going to die. So in nutshell, diabetes is preventable and diabetes is curable as per Acharya Sushruta. Andhano Vaidya Sandeshat eva purna ati tandrita samvatsrat va antarat pramehat pratimuchyate. If the proper regimen is dietary and lifestyle regimen is observed for the period of 1 year, one can get rid of the diabetes. Thank you. Here I will stop my presentation. We can take some questions.
Thank you, Agha sir. Thank you for the detailed explanation of Prameha in both Ayurvedic and modern aspect on the occasion of World Diabetic Day. Thank you, sir. If there are some questions by anyone, they can ask one by one.
If anyone is hesitant to ask the question, they can put the questions in Dropbox also. And by the time one gets prepared for asking the questions, we can get the comment from the MUHS observer and the moderator, madam.
Yes.
Can you call them?
Yes, yes. Sure, sir. I request to Dr. Sandeep Mani, sir, our today's MUHS observer, to say few words regarding today's webinar. Please, sir.
Hello.
Yes.
Hello.
Yes, sir. You are audible, sir. Please.
Audible. No? Okay.
Can you make your camera?
Okay.
Yes, fine.
Okay. Okay. Today is World Diabetes Day, and it's a good initiative to update recent knowledge of Ayurvedic importance of Prameh. I will share some experiences regarding diabetes mellitus. I recently read that diabetes is reversible through some proper Ayurvedic treatment and Rotacharya, Dinacharya. As we all know that Japanese biologist win Nobel Prize for autophagy. We should think like that. Langan is also best treatment for diabetes. But we firstly know the prakriti of the patient, and then we suggest that. I am thankful MHS for giving me opportunity for observer of this webinar. I am also give my regards to Dr. Vagesar and its coordinator for arranging such a wonderful webinar. Thank you. Back to host.
Thank you, sir. Thank you, sir, for your words, kind words. I further requested to Dr. Rupa Bhatt, ma'am, moderator of today's session, to say a few words regarding the session. Please, ma'am.
Sarvebhyo Namaskaraha. So really, after talking, after listening to the lecture of Dr. Subhash Wage sir, it is very difficult to talk because he'll cover for each and every subject A to Z, he'll cover. And I was thinking, I have written some of the things. I was thinking whether he'll not say this, but he has covered each and everything: physiology, pathophysiology, and also the diagnostic factors and the pharmacodynamics also he has covered. And even he'll not cover only the Brihatrayis, even the other Samhitas also. That is the beauty of his knowledge. So really, we are grateful to you, and I'll salute you, sir, for your knowledge. And as a moderator, I have to say some of the things. I'm working since 22 years. I'm practicing on this. But one patient, if I'll treat, the results are very good. The same treatment, if we adopt to the others, we were not getting the good results. Then I started thinking about the nasti rogo vina doshaihi yasmat tasmat vichakshanaha. So we always, even though for all the diseases, we have to think depending on the doshas. Now I started giving the virechana first, later I started giving the treatments. Definitely, I don't know whether it acts on the incretins or whether it acts as a DPP inhibitor, but we are getting the good results on that. And also Sushruta's principle, what he has told is right. We have to understand the principles behind that. As Vagesar already told, depending on their economic conditions, Sushruta has explained, and also depending on their occupation also. Yes, that is Brahmana. Jati is not depending on the how we are making the jatis now. It is depending on the occupation. Brahmarata by Brahmanas, and also walking Shatayojana and lead the life just like a Muni, etc. Those principles now many are using for reversing the diabetes. So we have to understand the principles which are explained behind that. And also Madhumeha and the Prameha, many times we'll get confusion. And earlier also, I was also thinking in the same way, whether Madhumeha is the whole Prameha or only a Vataja Prameha, or whether it is a Kafaja Prameha. But Chakrapani says that Madhumeha Shabdaha Samanyena Prameha Vachanaha. So that indicates we have to take it into consideration both as a synonymously, manywhere they have explained it. And some principles really will appreciate. Some of the diagnostic features are explained more vastly in Ayurveda than in the modern science. So as sir told how they have explained for the lethargy. So I have seen in my clinical practice, many will say the same thing. The tiredness they have explained in such a wonderful way. Sachapi gamanat sthanam sthanat asanam ichanti. That is, one who is walking want to sit, and sitting want to sleep. Sleeping means you want to take the complete rest itself. So, and also Vranaha Krichrena Siddhyanti, wounds will be healed very delayedly. So Sushruta in his Sutrasthana, he explains in the conditions in which Vrana will be healed delayedly, wound will be delayed. So that in those conditions, he has mentioned the word Prameha. And Dalana says that it is because of Dushta Dushyatvat. So wonderfully, like in modern textbooks, if you see the reason for delaying of wound in healing of wound in modern science, they say that granulation tissues are not formed properly. And Dalana says with the same in a different language, that's all, Dushta Dushyatvat. And also one more thing he has told, like Tanu Madhuryata, that you can see it in Ashtanga. Vagbhata says that Tanu Madhurya. Tanu Madhurya means we cannot taste the Sharira, but maybe that you can consider it as a hyperglycemia. I don't know, it is like my version. And also the Mandotsaha, Ati Stulam, Ati Snigdha Mahashanam, Mrityu Prameha Rupena. See how beautifully they have told. Mrityuhu Prameha Rupena Kshipram Adaya Gachati. We can become a like astrologers, and we can definitely we can say to the patients in our clinical practice, those who are not having the, like they are leading the sedentary life, and if they are having the staulya and their eating habit is not proper, definitely they may land up with the prameha itself. That too they say. And nowadays we are seeing within 5 seconds one is dying with the complications of diabetes. That has been explained here because our lifestyle and our food habits, everything is changing now. Mainly if we correct that, we can prevent the whatever the principles they have told in Ayurveda. If we properly follow it, we can give the better results than any other science. And one more thing, I was one of my student, PG student, was showing it. So in a males, actually the prameha is affected more, and also Sushruta says this. And in females, it is less. For that, Dalana comments that because of Masi Raja Pravritti, the females are getting it less. We are seeing nowadays like that is not proper because of the PCOS conditions, and many are suffering from the, and also we know that resistance to the insulin will be there by the PCOD cases. Right. So because of that, diabetes is increasing now for the females also. But earlier they have told that the males are more prone for the diabetes mellitus, as females are getting the menstruation regularly. So the Vishodhana occurs by that. That's why they'll not be suffering more from the diabetes that is there in the Sushruta. So anywhere if we search, we are, and Dantardina Maladyatvam Pragrupa Panipadayoho, that is the Purva Rupa. So I was seeing the oral Dontics book. So in that also they have written the periodontal infections or the periodontitis is most commonly observed in the diabetics. That has been told in our Purva Rupa itself, right? And so whatever our acharyas have told, always it will be true, but you can appreciate that by having the modern knowledge, and really by hearing to the Subhash Wage sirs, because one day itself we cannot learn everything whatever he has done, whatever he has explained. Now we require like a bit more time, and in his books we are getting all those things. So regularly I'll be seeing his books before going to the classes, and many references we are getting from him. So I'm not only boosting sir as he has given the opportunity, but really we should be lucky to have Subhash Wage sir in our fraternity. So I'm thankful to him, and also MUHS. So that is conducting a more and more programs, and they're given us the opportunity. So thank you, Subhash sir. Thank you.
Thank you, ma'am.
Thank you, madam, for your detailed elaboration, and you have added to our knowledge also. It's true that our acharyas have attributed the less preponderance of diabetes in females because of the natural Raktamokshana they are having, and the male preponderance of diabetes in males because of, I told you, the tendency to have visceral fat and that Lambodara, which we have inherited from centuries together. That's why we Indians have the type A personality, which is more prone to face the diabetes and ischemic heart diseases. That is And another thing which I forgot to mention is the rampant use of antibiotics, which is prevalent nowadays. That is having the role in developing the obesity, and obesity predisposes to the diabetes, as we have seen. These antibiotics, what they do, they kill the beneficial bacterial flora, and these, the abnormal secretion of hormone, incretin, etc., from the gut, because there is a gut-brain axis, and everything, the wiring, internal connections of the body is such that the whatever that is required in the body, that is everything, the programming is already done, and which what is deficient, that is met, that demand is met, and what is excess, that is driven out. Everything is there, and this hormonal disbalance takes place because of when we are killing the beneficial bacteria. That's why, because of those who consume antibiotics frequently, they are predisposed to the obesity, and from obesity they are predisposed to the diabetes, and from diabetes, as it is said, the Prameha Anushanginam, the host of the disease, the ischemic heart disease, coronary artery disease, and all the complications of the diabetes you can get. That is the thing. Another one interesting plant I came across very recently, that is the plant, the name of the plant is itself is insulin plant. And nowadays more and more people, they are even more from the modern fraternity, they are using that insulin plant, and they are asking the patient, because at some point, as I told you, because of the problem of the adaptability, the resistance is occurring to all the drugs and therapies, and whatever the measures they give relief, they are prescribing, apart from the adjusting the lifestyle and dietary factors. These small steps, they are also helping. This particular drug is they are saying that it reduces the daily insulin requirement significantly. More studies needs to be done in this regard. But our acharyas, that's Prameha Anushanginam. That is very important. They have mentioned almost, as far as Prameha is concerned, their study, the Ayurvedic literature is very, very rich as far as the diabetes is concerned. If there are any questions, we can take.
In chat box, there is some question, maybe I'll read. In a pregnancy-induced diabetes with no any family history, only dietary modifications required for a year, or will okay. They are asking about a pregnant condition.
Okay, gestational diabetes, but that will get automatically corrected once the baby is delivered. After, you see, after 3 months, the hormone levels, they come to the normal. And in case if they do not come to the normal, you have to test the blood sugar every monthly, and just observe whether there is constant rise in blood sugar. But it is very unlikely that when there is no family history of gestational diabetes, then it's very unlikely to continue to help raise blood sugar. It will resolve automatically.
Thank you, sir. Thank you, Rupa Bhatman, for adding the knowledge and your experience. Now I request Dr. Santosh Chauhan, sir, to add, to say some words regarding the webinar. Please, sir. Santosh Chauhan, sir.
Chauhan sir, you are not audible.
Yes, sir. Am I audible?
Yes, you are audible.
Now you are audible.
Okay. Good afternoon to each and one and all. Myself, Dr. Santosh Chauhan, who is working as a General Secretary of RVPGA. Today, at the start of our webinar, Dr. Aishwarya ma'am has given in brief about the RVPGA. RVPGA is a one association who is working for the betterment of the Ayurveda vis-a-vis Rog Nidan subjects. So today, as a General Secretary, on behalf of our RVPGA, I would like to give to express my vote of thanks. So first, I would like to give thanks to MHS authorities and the authorities and the management body of the Jupiter Ayurved College and the principal. And next, I would like to give thanks to respected Rupa Bhatt ma'am. And the most important, the special day for me, who is working as a MHS observer, Dr. Sandeep Mane sir, who is my close and very nice friend. Thank you, sir, for working as a MHS observer. And the last, each and one who have contributed for the success of today's webinar. So thank you to each and one. And the last, and but not least, just I am taking the name of Dr. Subhash Wage sir, who is always ready, who is evergreen for giving the feast of knowledge of Ayurveda to each and one in scientific manner. So thank you, sir, for today's very nice in brief how to approach, how to diagnose the diabetes on occasion of this today's World Diabetes Day. Thank you, thank you, thank you each and all. Thank you, sir. Thank you, ma'am.
Thank you, Dr. Santosh Chauhan, sir. Now we move to the next session, vote of thanks. Today we all witness the great academic feast from our today's speaker, Waghe sir. I thank you, our principal, Dr. Subhash Waghe sir, for his wonderful lecture on the topic Prameh Prabodhanam 2022. Similarly, I thank to our today's chairperson, Dr. Rupa Bhatt ma'am, Principal, Dhanvantari Ayurved College, Sitapur, Karnataka, for the wonderful remarks. Thank you, ma'am. Thank you so much for spending your valuable time with us. I'm also thankful to MHS observer, respected Dr. Sandeep Mane sir, for his valuable presence. Finally, I also thank to our associate partners, Dr. Santosh Chauhan sir, Dr. Aishwarya Ranade ma'am. Finally, I thank to our secretary ma'am, respected Mrs. Tarini Nikhare ma'am, our principal sir, and our organizing committee members, Dr. Shrikant Hadoe, Dr. Sangeeta Gupta ma'am, Professor and HOD, Kai Chikitsa Department, Dr. Amol Khatri sir, Associate Professor, and Dr. Vaishali Mishra ma'am, Assistant Professor, Kai Chikitsa Department. Last but not the least, I thank all the audience for attending the session calmly. Once again, I owe my gratitude to all, and with the permission of respected principal sir, I conclude the session here. Thank you.
Thank you. Thank you, everyone.